muling tumaas ang bilang ng mga nasawi dahil sa 2019 novel coronavirus.
Bureau of Customs na kaalerto rin laban sa 2019 novel coronavirus.
The 2019 novel coronavirus respiratory infection, now known as COVID-19, has spread throughout the world, infecting thousands and killing hundreds more. The government has pulled all stops in containing the disease, from week-long quarantines and information drives to a travel ban on affected countries. Out of all these efforts, the travel ban to Taiwan gained flack for its effect of Filipino workers there, to the point that the Taiwanese government itself has intervened on the matter. Today, in Pros and Cons, we raise the question: is the Philippines ready to take part in global efforts to stop outbreaks like COVID-19? How can we contribute to efforts to contain the disease? Is a travel ban at this point necessary to stop the spread of COVID-19?
Good day once again and welcome to Pros and Cons, where we ask the hard questions and you decide which side of the truth you would choose to believe. Mga kababayan, last week we started the discussion on the so-called novel coronavirus or nCoV. Before we ended the discussion last week, there was a hanging question about travel ban. So tama lang po ba yung naging natin?
To be honest
Reaction
po,
dyan?
as an observer, as a medical practitioner, nung una sabi ko, bakit ang bagal?
Okay.
Ganon din ang naging
Yes.
reaction ko. Tulad po siguro ng kabayan natin. Kasi when you want to assess it more, number one, napaka-porous talaga ng Philippines.
Okay.
Ang dami. Tapos, ang daming entry points, ang daming exit points. Tapos, magkakaroon siguro ng malaking issue sa implementation. Kasi marami ng kawing-kawing na issues As you mentioned, Usec, paano yung mga OFW? Paano ngayon yung nagta-transit lang ba? Pati yan, iba.
So maraming consideration.
Maraming consideration. Tapos naka-angkla pa rin ho siya. Teka, kaya ba natin?
Oo.
O nagko-contact tracing kayo, kaya nyo ba na buong eroplano?
Oo.
Or let's say, so ang point ko, if we're going to come out with policies, it should be policy na kaya nating implement. Kasi ironic, no? It should really be ironic, nagkaroon ka ng policy, you're saying because of the health, yet there are a lot of loopholes in the way you are implementing it. Di mas lalo pa kung magpapanik yun, di ba? So dapat wala siyang disconnect dapat. As what Dana pointed out, dapat data-driven yung decision. So it's based on study, it's based on what we know, and then we react accordingly.
Alright. So, kailangan intelligent yung reaction natin.
I guess so, sir.
Learned. No. Alright. Salamat po, Doc. Kasama pa rin po natin sila Miss Dana from Sandoval from the Bureau of Immigration. Of course, Miss Sisi and Ernest Wang. No? So, we're just going to pause for a little break, and when we return, we will continue our deeper discussion, so that we're going to have a deeper understanding about the nCoV virus. So, pros and cons, we'll be right back.
We have initiated the repatriation of 30 Filipinos from Wuhan City, China. Upon their arrival at the Haribon hangar at Clark Air Base on 9 February, they were safely and swiftly transported to the athletes' village. Whether you like it or not, I will bring them home. I will bring them home to seek shelter in their country. Saan pa pala sila tatakbo? To assure all our Filipino brothers and sisters that the national government remains to be on top of the threat of the coronavirus. We are prepared to handle all public emergency in case the worst possible scenario happens. Other concerned agencies so that we can meet the needs not only of those who were not affected by the virus, but also the welfare of our frontline health workers. To all chief executives, I hope that this situation will further strengthen our commitment towards becoming responsive and conscientious servant leaders that our country can protect and rely on. May you continue working with us so that we can secure a stronger and healthier future for our country.
We're back on Pros and Cons, and mga kababayan, kasama pa rin po natin sila Doc Jubert, kasama pa rin po natin si Dana, si Miss Sisi, and si Ernest. And ngayon, I'd like to ask Dana, no? Pinag-usapan naman natin yung travel ban. Gano'ng katagal tong travel ban na ito? I'm sure maraming mga kababayan natin, ng mga OFWs ang interested.
Yan po talaga yung lagi namin na-receive na question. But sa ngayon po, there's no timelines yet kasi like what was discussed earlier, we work on what we are discovering every day, and araw-araw po yan, it's changing, nagbabago. We also base itong mga actions natin, the government is basing its actions on recommendations from the Department of Health na anchored on the on WHO. So as we go along, we will siguro learn more about this virus para malaman po natin, should it be expanded or should it be stopped already?
Alright. So, walang specific, no?
Sa ngayon po, wala
definite
pa.
timeline.
Yes.
Wala po itong timeline. So, what our kababayans need to do is to, always keep themselves informed, no? And updated.
The right way.
The right
The
way,
right way.
no? The right
Yes.
way, the right thing, the right way. Hindi yung baka sabihin, merong pwede nang lumakad. Because some people are actually thinking na kung halimbawa babalik sila sa Hong Kong or sa Macau, dadaan na lang daw muna silang Vietnam. Can it be done?
That's putting themselves at risk. Kasi kaya nga po tayo naglagay ng mga ganitong travel bans is to prevent the spread. But circumventing it would maybe make it worse because you instead of going directly to one country, inikot nyo pa po. So mas
Ikot
marami
pa.
pang tatamaan, mas marami pang
Kung
posibleng
sila ay
tatamaan.
but they can do that.
Well, no. No, because that's misrepresenting already. That's
Alright,
misrepresenting
so
already.
hindi talaga pwede.
Hindi po talaga pwede.
Okay, hindi mo kayo lulusot. Alam mo, hindi ko invento. Talaga may nagsabi sa akin, pwede bang gawin kaya namin? Yung sabi ko, hindi ko alam yan. Paano? So, hindi po pwede at iba na po yung nag-iingat. No? Alright, Sisi and Ernest. Sisi first. How satisfied are you with the Philippine government's preparation to stop the spread of nCoV or nCoV?
Okay. Actually, to my observation, actually very, very strict on travel ban to just issued by Philippine government. And I also saw a lot of news about the inconvenience caused by the travel ban, no matter those tourists, but also some business and also a lot of OFWs, they could not go out. One of my colleagues ever went to the to the airport, and he heard that one OFW said, "Boss, I could not go. My president do not let me go." Something like this, and. Maybe here I would like to share a little information to our Filipino friends. Actually, refers to the travel ban. Our Chinese audience, listener, and all the readers, their reaction is acceptable, understandable, and even
Hindi naman sila galit sa atin dito.
even support sila because it's an emergency. Because it's a very, severe situation ngayon. And they know that this is a time to stay at home, to self-quarantine. Instead of going out to enjoy the sunshine beach in Philippines, much importante na stay at home. Do not go
safe
outside.
Sila. But meron din bang, parang travel ban naman from China in going to the Philippines, no?
No.
Wala. Walang travel ban?
Well,
from
that's
their government.
yes, that's their government's decision. But I understand within cities, there are certain cities in China that have lockdown.
Dahil nga wala naman nagsabi na it's up to you, no?
Yes.
Kung may travel ban ka
Yes.
or wala.
I want to say that all the Chinese people, of course, they understand the Filipino government and also our government suggest our Chinese stay in the country, do not travel abroad if no some emergency. But the problem is how how long is the travel ban? That's where we're concerned.
Yeah.
And second, is there any details or some other policies to help the Chinese and Filipino keep the normal exchanges? For example, the business,
Yeah.
the trade. Sometimes there's example. One of our Chinese students who learn Filipino here, he because expire of his visa, he must back to China and then apply visa to keep here first to study. But because the travel ban, it's so difficult for him to apply the visa. So I think this is also it's just one example, but I think it's already really affect the normal exchanges. So for our Chinese as a journalist or as a Chinese, we want to of course we understand the Philippine government. We also want to have some details to keep the normal exchanges of our two countries.
That's one thing na it really, it surprised me. No? Like, for instance, for the information of our mga viewers and followers po, sa totoo lang, no? And, please correct me if I'm wrong. Nung araw kasi, compare natin yung H1N1 virus, no? Alam niyo po, more than a million people were affected by the H1N1 virus. And hundreds of thousands died. Right?
Correct.
And there were, I think, 200 places all over the world. Something, no?
It's all over.
It's all over talaga.
Yeah.
But here's the catch. The virus started from the United States. Pero wala naman tayo. Ganyan na parang naging phobia sa mga Amerikano noon or people who were coming in from the States that time. Pero ito, grabe eh. Ang tindi nung phobia na umiikot, no? Is it because of, the advent of social media, ang bilis ngayon, or talagang merong, alam mo yun, parang biased view against the Chinese here, no? Something like that. How do you feel about it?
I agree with Mom Dana said that it's about because of the ano po yun? Because medyo malapit ang
Proximity.
Proximity.
Oo.
Dahil medyo malapit ang China at Philippines, mga 4 hours lang ang flight. Pero kung mabanggit ang US, medyo malayo. Parang malayo. Pero actually malapit ang connection ang US and Philippines. For example, my house owner, kasi nakatira ako sa Makati, my house owner, kanyang anak nag-aaral na sa US. Pero wala. Parang, you see, when we talk about China, parang negative. Purong negative.
Puro negative.
Pero kung talk about US, at least 60% positive, 40% negative, parang ganon. So when we talk about China, it's a little bit
negative. Kasi ang lapit. Sobrang malapit. Alam mo yan ano yan? Distance makes the heart go fonder. Familiarity breeds contempt. No? Because we're so close, as neighbors, parang nagkakaroon ng contempt. Anyway, ang dami pa po natin pag-uusapan dito, no? Marami akong tatanong pa kay Doc Jubert and of course kay Dana, but let's pause for a break muna, and when we return, we'll check out what social media again has to say about today's topic, especially on the issue of in travel ban. Alright, so pros and cons, we'll be right back.
When we talk about repatriates, we would like to inform you that the Department of Labor is ready with its reintegration program. But this refers to yung mga OFWs, yung mga OFWs na i-repatriate natin from China, from Hong Kong, from Macau, and probably even from Japan. We have a package of repatriation program. Number one, of course, is immediate financial assistance. When they come here, no question asked. As long as you're an OFW, active member of OWA, we give you financial assistance. Then, aside from that, we also have yung livelihood assistance. And then, I'm sure most of them may also consider another employment opportunity. So we have also a alternative employment abroad na naman yan. That's why we have been busy establishing labor relations with countries such as Canada, Russia, Czechoslovakia, Croatia, and then even China. Meron din kaming tinatawag na livelihood assistance if they want to go to business rather than get another employment, we can provide them. Ang minimum assistance namin dyan ay 20,000. Walang yan, hindi yan pautang, bigay yan, assistance yan. But they can go as high as 1 million depending on anong business na papasukan nila. Pero ito naman, interest-free. And then finally, this is a long-term assistance sa ating mga OFW. This is the so-called scholarship program for the children of our OFWs. Basta gusto mag-aral ng ating mga OFWs, we will provide them free education.
You're still watching Pros and Cons, and mga kababayan, patuloy pa rin po natin pinag-uusapan ang tungkol doon sa novel coronavirus at yung travel ban dito. And just like last week, meron po tayong pinost na poll question, this time about the travel ban. Ang tanong po natin sa PNA website, narapat bang pagpatuloy ang pagpapatupad ng travel ban sa mga bansang mayroong kaso ng novel coronavirus? And the results of our poll ay ito po, 72% sinasabing okay lang yan, ituloy. No? And 28% sasabing wag na. So ito siguro yung mga naipit na nagbakasyon dito, inabutan. But speaking of in travel ban yan, let's get this very important clarification from the Immigration Bureau. Hindi po selective yung ban. Please expound on that, Dan.
Yes, opo. Ang travel ban po natin is for all foreign nationals coming from China, Hong Kong, and Macau. So this means all foreign nationals po, not just the Chinese, hindi po targeting specific races, but lahat po ng mga foreigners na nanggaling doon. Because what we're trying to do is to prevent the spread through travel.
Yes, so
hindi
that's
po,
the reason.
Yes, it does the virus does not choose the Chinese na yun lang ang aapektuhan niya. But kung sino po yung nandun sa area na yun yung mga possible na carriers of this virus.
So parang containment ito no? So we need to contain, and kung halimbawa European ka at naka-contract ka dito ka na lang.
Yes.
Kaysa pupunta ka pa nga naman doon.
Yes.
So hindi lang po puro sa
So
mga
kahit
Chinese.
ano pong nationality that halimbawa nanggaling dun sa bansang yon could be a potential carrier of the virus. That's the logic behind the implementation of this directive.
Let's be clear on this also. So number one, hindi naman siya selective, hindi naman mga kaibigan natin Chinese ang target lang ng travel ban, but all foreigners. And number two, there's no pandemic. No?
Wala po. Kasi,
walang pandemic.
Opo, ang tamang label lang talaga ng WHO is Public Health Emergency of Global Importance. May kino-compute po yan ng mga figures. Basically, tinitignan po nila yung kung rapid spread, etc. Gaano ba siya kalawak. Based po dun sa computation, they labeled it as such only, not pandemic, not
Alright.
epidemic.
Compared with, again, the H1N1 virus, kasi grabe ito recent din ito, 10 years ago. Ano ang level niya with the coronavirus?
Well, more of yung sa death rates po talaga ang pinapublicize nila. So for example, SARS way back in 2002-2003, around 20% po yung mortality rate. MERS-CoV around noong 2012, around 30 to 35%.
Wow, taas.
Sa ngayon po, yung nCoV is less than 2%.
And how soon can we or can the experts come up with a, di ba?
Yung vaccine.
Yung vaccine.
Yeah,
yan
or
ang mahalaga
antiviral agent. Mahirap po yun kasi it's a virus, so there's a lot of, technicalities behind, let's say, finding a cure, even vaccine. What I know is yung mga experts po were gathered by WHO specifically for these things. But right now, ang kanilang recommendation is number 1, really there's no vaccine for it. Number 2, your antiviral does not routinely work.
Yeah, okay.
So yung mga nag-spread po ulit sa social media na yung mga anti-HIV daw na retroviral agents. you
Hindi
can take
mag-effect.
it. Hindi po siya. Hindi pa po based sa science yung behind it. Yes, there were some signals pero hindi pa po siya ma-recommend.
Not even powerful antibiotics.
No, you don't need antibiotics pa in the first
Virus
place
kasi.
dahil po virus siya.
Alright, so kung hindi pwede yung mga antibiotics, wala.
Prevention pa rin.
Prevention
po
is the best
Prevention
cure.
pa rin. Tapos wag naman sana kung magkaroon ka nito, just like any virus, symptomatic po yung treatment and then papalakasin mo dapat yung immune system mo.
When you say, ayan, in layman's yung symptomatic na sinasabi.
Pag may lagnat ka, binibigyan po kayo ng paracetamol. Madalas po ang mga ganitong kaso, based at least dun sa studies mainly emanating from China, they do have secondary bacterial infection and therefore yung antibiotics is geared towards the secondary bacterial infection. They give some para sa mga pain,
I see.
myalgia, parang pain relief po.
Parang, ayun nga, parang ano kasi yan yung...
Parang flu trangkaso po.
Trangkaso, masakit mga kasukasuhan, sabi nila. And if I understand it correctly also, permit my little knowledge about that. Dahil galing nga daw to sa hayop, yung antibodies natin, hindi niya agad matira, no?
Yes. Opo. Ang normal kasing reservoir na na-identify sa kanya, signals are there to tell us na galing po siya sa hayop and therefore yung pag-transmit niya sa humans, syempre hindi ka handa, ikaw as a human.
But, again, will there be a cure?
Umaasa po tayo, hopefully. I've never seen science in this case really growing at a fast rate. Tuwan-tuwa ako, maskin may local experts tayo, getting their heads together, looking at the whole situation. So, hopefully, yes. But as of now, as what DOH was saying, mataas po, relatively speaking, yung cure rates niya.
Okay.
And therefore, ang cure rates niya sa ngayon, kahit sabihin nating symptomatic treatment lang, pagpapalakas ng immune system, it works.
Alright.
Nakiklear po siya.
Okay. Mas mabilis nag-spread yung fake news virus kaysa dun sa actual virus. No? I mean, grabe. And people are more concerned about, alam mo yun, yung konting, instead of, sabi ko nga, iba yung informed ka. Sila, kung ano yung dumating na negative na balita, yun na naniniwala, nalulundag agad. And that contributes to the, ang tawag dyan, yung overblown psychological reaction to the problem. So, do you think magsasubside yan?
Actually, here I could I could understand because your bad news is spread much faster than the good news, especially in eye attractive news. For example, how many people died, the street was full of bodies, such kind of even video clips full of the social media. But what I should see is that actually your understanding and your focus on the good news or the true news is a big support to the Chinese people. Instead of going back to Philippines, they choose to stay in Wuhan, and they even compose a song, Bagong Wuhan, yan para show their encouragement to all the Wuhan friends. And also, according to my knowledge, there are about 300,000 Filipinos ngayon sa China, but only no more than 50 choose to come back because they all believe that this virus could be controlled and could be paday, discriminate one day. So they have their trust in Chinese government, their Chinese friends. We are also very thankful for their support. And especially in this moment, I just said, so your support to Chinese people is actually parang their strength to fight against the virus.
That's good.
Yeah.
Ernest, you're with the Chinese media here. No?
Yes.
How do you help? Anong ginagawa nyo? What do you actually do to actually help address the problem?
Well, first we do our best to report what happened here in the Philippines to our to the Chinese, and of course we will report also what happened really in China to the Philippines, because as I know, after the block of Wuhan and Hubei, I feel that the only way of the authority resort is from the government, because I think all the foreign correspondents they back to their country. So that's what we can do here. And secondly, we will suggest our friends to protect themselves. For example, wear the face mask to avoid some.
Yeah, again, it's personal hygiene.
Yes.
No,
And
prevention is
thirdly,
the
of
best,
course,
right?
we will suggest our Chinese, some Chinese community here to donate some face masks to the local Filipino to help them, because we know until now the face mask is a very strategy products here. So we suggest the Chinese community to donate
And they
some
can,
face masks.
people can actually wear face masks that are made in Wuhan. Think of that.
Yeah, but I know that if we read the news, that I think the Chinese community here to also donate for the local Filipinos.
All right.
And they also provide some medical service.
That's good.
Yes.
All right. Anyway, so we finally reached the conclusion of our discussion. So there you have it, folks. Straight from the shoulder and right on the money. But before we go, I would like to get a few words from our guests, no? Starting siguro again from Dr. Jubert, since kayo po ang medical expert dito sa ating harapan ngayon. So ano po ang mensahe ninyo sa mga kababayan?
Mensahe ko lang po siguro, let's cooperate with the Department of Health directives. Please makipag-cooperate po tayo sa frontline health workers. Those who are working in the hospital, alam ko pong mahirap tong situation natin lahat. Nakukulitan kayo sa amin sa pagtitriage, etc. But please know that this is for the public welfare. And lastly, let's pray that this situation will get better. And of course, pray for your healthcare workers.
All right, thank you very much. Very well said. Especially yung pray for your, alam mo yung exposure ng mga health workers.
Yeah.
Sila yung frontline talaga eh. Sana may unawaan po ninyo yun. Anyway, Dana, your message po sa ating mga kababayan.
Siguro po for the travelers, of course, if your travel is non-essential at maaari po munang ipagpaliban, pagpaliban po muna natin ito habang gumagawa po ng paraan ng ating mga eksperto para malutas po ang sakit na ito. Also, let's always follow the recommendations of the Department of Health on proper hand washing, sanitizing. Sundan po natin yan. Let's follow that para masigurado po natin na hindi na po further kakalat ang sakit na ito.
All right. Thank you very much for that, Dana. And of course, Sisi, your message to our friends.
Yeah, let's just keep finger crossed for all the Chinese friends who were infected, especially in the epicenter Wuhan. And also we pray for all the Filipinos now working in Wuhan, live in Wuhan, for their good health, and that one day when the travel ban was canceled, they can come back to Philippines safely and healthy.
All right. Thank you for that. Ernest, your message to our
Yes,
friends?
first I would like to thank the Filipinos in Wuhan. Thanks for your support and confidence to Chinese government and your Chinese friend. Secondly, I advise our Filipino friend here and our Chinese friend here to follow the medical advisory to protect yourself first, and then to protect the people around you.
All right.
Like fighting the guys at laban tayo.
Laban. Laban tayo. Don't forget to tune in next week for another issue of national interest. Sana wala na itong NCOV na yun. For your comments, suggestions, and questions, visit our Facebook page and the PNA website. You may be for or against. You may agree or disagree. In the end, we're all Filipinos working towards the same goals, like solving this NCOV problem. Will you choose what's right? Or will you stay on your side of the truth? Once again, this is Philippine News Agency Supervising Undersecretary Joel Sy Egco. Thank you and see you on the next episode of Pros and Cons.